All right, good afternoon. My name is Christopher Johnson. I serve here at Texas Women's as the Chief of Staff, and today also as your MC on this town hall. In times of disruption like we're in, it's oftentimes we're at a loss to fill in details about what we should expect based on past experiences, because everything is different. So I think in these times, some over-communication is often helpful to give us courage in this ever-changing landscape. So that's what today is about. It's going to help complement our social media work, our email messages that you've been receiving, the wayfinding that you'll find around our various campuses, and other forms of communication. So this will have a little bit more of a two-way form of communication, in the sense that you'll have an opportunity to directly ask questions during this panel conversation. I'm going to start out by demonstrating some of the features of this webinar software. At the bottom, you'll notice that there's a Q&A icon. So that's going to be your primary way of asking questions. And right now I'm going to demonstrate that by asking Anne if she would ask, who are the panelists? And I'll use this feature as a way to show who the panelists are. So I'm going to type my answer here. And that way you can see who all the panelists are, where they are representing, from where they've come at the university, and also some of their contact information if you might want to follow up with one or more of them after the conversation. So if you look over in your Q&A section, you'll see in the answered area, I've just answered that question. As we go through, Matt Moustakis, who is Director of Risk Management, he is going to be giving the presentation today, but various of the panelists will ask questions that you may have as he's going along and presenting information. He may not cover everything in his presentation. You may have additional questions that you'd like to ask. So that's how this is going to work today. You can upvote questions by clicking the little like button by a question, meaning that more of you have that same question. And so you can wait for one of the panelists to answer it. For some of the questions, we may want to ask those live, and we'll bring those in, and that'll be my main function, is to bring those back to the live conversation, have Matt or one of the various colleagues here answer that question. So without further ado, I'm going to turn this over to Matt and let him talk us through some of the Q&A.
All right. Thanks, Christopher. You hear me okay, I assume? So what we're going to do first, I have a presentation. It's supplementary to what we've already covered in the onboarding training. Just as a reminder, if you haven't already done it, all employees who are returning to campus need to complete our onboarding training. It covers in a lot more detail than what I'm going to do right now, what the expectations, what the new procedures are for this fall semester. But we're going to cover, what I'm planning on covering is a lot of the most common questions we get, a little more detail, kind of the biggest concerns we've been hearing, hot topics, let's call it. And then there'll be plenty of time, hopefully, at the end for your questions. And as Christopher said, feel free to go ahead and put questions in, either in response to what I'm presenting here, or just if you already have a question, go ahead and put that in. The panelists who are helping us present this will be able to respond in real time. If we feel like it's better answered verbally, then we'll do that at the end of my presentation. Or if Christopher feels it's critical, we'll jump in. But before we get started, I do want to say one thing. Everything that we talk about here is potentially subject to change, right? This is a very dynamic situation. We get new information all the time. And we've gotten questions recently about what triggers would cause us to do certain things. So for example, what would it take for everything to move online or close the residence hall or something like that, right? Dr. Phaeton has really talked about the need to stay flexible. So we haven't set specific triggers. If Y happens, we'll do X. Instead, we're really looking at the situation holistically, trying to look at everything that's going on in our community, the various municipalities that we operate in, what's going on with our community, basically, as well as the outside world. There are some things, obviously, we're looking at, factors that we would consider. So, for example, is our contact tracing becoming overwhelmed? Are we running out of isolation and quarantine rooms and residence halls? Importantly, have state or local orders tightened in a way that would affect our operations? So those are things we're looking at, but again, none of them is a hard, like, if this, then why. I'll emphasize that the more important than having set triggers is that Dr. Faden and the TW leadership, the emergency management teams, we're meeting basically constantly. It was daily meetings for a while. We're doing several times a week right now. But we are constantly discussing the situation. What is going on now? What are the factors affecting the university? What's the recommendations from the CDC, from state, local governments, et cetera? Changing course as necessary, right? So I just wanted to, like I said, we can't say if X happens, Y will necessarily occur, but this is constantly being discussed, constantly being reevaluated, and very much focused on the health and safety of the TW community overall. So with that, I'm going to go ahead and start. I can make it change slides. There we go. So this is what I have for my topics of kind of the frequently asked questions. That's not exactly right, but the hot topics, let's call them, right? So we're going to cover this. And again, we're going to have time for additional questions either on these or other subjects. So first, COVID-19 transmission. One of the things we really wanted to emphasize is that all evidence right now points to transmission primarily occurs as a result of prolonged close contact, right? What are we talking about? We mean within 6 feet, 10 or more minutes cumulative within that 6-foot bubble of somebody, right? So passing somebody in the hallway, seeing somebody as you enter a door, low risk. Someone that you spend that 10 minutes over the course of a day, within the 6 foot, that's what we're mostly interested in. Contact with contaminated surfaces, I should say, has not been found to be nearly as significant a route for transmission as we were originally concerned about. That said, enhanced cleaning and regular hand washing are still very important precautions, right? Hot topic always, face coverings. So these are the basic rules for face coverings. They are now required in all TW buildings, right? At one point we had talked about if you're within 6 foot of somebody, then you have to wear a face covering. Again, that's an example of where we looked at the evidence, we looked at the situation, we heard feedback from the TW community, employees in particular, and changed to say, okay, face coverings are required in all TW buildings. They're required when you're outside if you can't stay 6 feet from others. Face coverings must cover your nose and mouth. We don't want them to have exhalation valves. This is the valve that helps prevent from steaming up your glasses, unfortunately. And ideally not large gaps. If you just have a bandana hanging over your face, that's really not what we're looking for. We'd rather have a more well-fitting mask. There actually is some brand new data regarding the gaiters. This is the little stretchy things that go around your neck, you pull up over your face. Those have not shown to be effective, so we're discouraging using those. Find something that's more effective than that. And on our website, there's a lot of information about how to either make your own mask or where you can get them. I think we even are selling TW branded masks in the bookstore now, so it's another option. Face shields may not be used instead of face coverings. There was discussion about this early on. We thought that maybe that one might be an alternative in some cases, but the CDC came out saying that that really isn't the same and you need to have a face covering. Big point though, maintain social distancing whenever possible, even when you're wearing a face covering, right? If we have a positive case on campus, let's say one of your coworkers ends up testing positive, even if you are wearing a face covering, if you were in that 6 feet for 10 minutes or more, we're going to consider you to have potentially been exposed. And so you're going to have to quarantine. So as much as possible, limit the amount of time you're within 6 feet of other individuals. A little more about face coverings. There is no exception to the face covering requirements. As I said, they protect you and they protect others, right? If you have a medical condition preventing you from wearing a face covering, contact Human Resources regarding possible Americans with Disability Act accommodations. They're not going to look at anything other than medical requests. If it's not a medical condition, it's not going to be approved. We get a lot of questions about what happens if you see someone not wearing a face covering. The best recommendation is, at a minimum, to protect yourself, keep your distance the best you can, right? If you pass somebody in the hallway, obviously you're not going to be passing the hallway for 10 minutes, so it's low risk. However, just keep your distance as much as possible. If you feel comfortable, you can certainly say, hey, just as a reminder, face coverings are required in the building. And anecdotally, especially from the experience of our staff in the library, when people are reminded, they're more than happy to comply. It hasn't been an issue. So you're not required to confront them, but if you want to gently remind them, that's fine. Student accommodations as far as masks, instead of human resources, of course, these will go through disability services for students. Having a student not wearing a mask in class or on campus is the very last resort. They're going to work with the students to make alternative arrangements to prevent that from being necessary. So that might mean potentially having an online section of a course or other accommodations along those lines. I want to talk a little bit about workplace modifications. As we've said a couple times, or I've said a couple times, COVID-19 spreads via close contact. Thus, modifications to your workplace are going to probably be necessary, right? Don't assume that you're going back to your cubicle or your workspace right next to your neighbor. We want to keep that 6-foot buffer as much as possible. Environmental Health and Safety has developed a guidance document providing various options on how to accomplish this. Some options, obviously, are rearranging furniture. That might not be possible everywhere, but staggered schedules and breaks, rotating staff on or off campus, plexiglass shields. You've probably seen some of those if you've been on campus already. So, talk to your supervisor about what their plans are. If you are a supervisor, you should definitely look at this before you have all staff return. In fact, it's very likely that if you have a fairly dense workplace, you're not going to have all staff there all the time. We're still encouraging that if at all possible, if you can do your job and you've talked to you've worked with your supervisor, obviously, that working remotely, if that works for you, that's a great option to help de-densify your workplaces. Some other examples, custodial, right? They used to go to the time card at the same time every day, take break at the same time every day. Now that's all broken up so that they're not having that contact. ITS is doing it where they have enough people on campus so they're able to meet the desktop and other service needs of their customers, but everyone who doesn't need to be here for that, they stay home and then they rotate on. In-person courses. So Academic Affairs is working on, and I think they're about to distribute, if they haven't already, a guidance for faculty leading to in-person courses. We have a lot of questions about this. Maximum capacities have been set at 50% of normal, right? You're gonna want to ask students to spread out in the assigned space as much as possible. We had a lot of questions about, is there going to be a seating chart? Are each of the chairs that you're not supposed to be sitting in marked off? That's not the plan. The plan is really, you're going to be assigned. Dr. Martin and her group has just spent a lot of work on looking at, okay, this classroom can normally handle 40 people, so it's going to be assigned to 20. So the room that you're assigned to teach in is going to be half the capacity of what it normally would be. And so you just need to have your students spread out as best as possible. Something that we ask, if at all possible, track attendance and if possible, have assigned seating. The reason for this is that if we have a positive case or somebody with symptoms in your class, and we don't have that information, you're going to have to potentially take the entire course online, right? If we do know that in the 2 days they were infectious, this particular individual sat within 6 foot of this person, and this person, well, then we can just have those people quarantine and the rest of the class could potentially go on. If there has to be group work, assign students to groups that don't change. So for example, some physical therapy, for example, they have to necessarily have students within 6 feet. And so they're going to be in a group that works together throughout the entire semester. So if one of them, and those groups are separated from others 6 feet, that way we can isolate a positive case to that one group. As I said, Academic Affairs is working on a much more detailed guidance. This is just kind of the highlights right now. Along the same lines, in-person events and meetings. So this is a big change that we made recently all in-person events and meetings now require VP approval. Obviously, the in-person courses were approved by Academic Affairs and by Dr. Kapinas, but for all other in-person events and meetings, there's a form now online that's going to be posted on the coronavirus website that needs to be completed. The reason this was done is that there was a lot of concern that departments were just going to go back to their normal, all right, we're going to have our staff meetings once a week in this room, or we're going to have orientation, or whatever the case may be, in the normal fashion. This isn't to say that in-person events aren't going to happen, of course. It's just that we want to make sure that the new normal and the new requirements are being adhered to. If at all possible, do your meetings virtually, right? That's the first choice. Just like I said, if you can work remotely, that's great. If you can still meet your function that way. If you're going to have an in-person one, try to have a virtual attendance option, right? There's going to be a large number of our community potentially who are either on quarantine or isolated, or more commonly are high risk, or have family members or roommates or whatever who are high risk. So if we're going to have an in-person event, let's try to have a way for them to attend virtually, so we're not excluding anyone from our on-campus activities. 6-foot spacing and face coverings are going to be required in all in-person events and meetings. That's the big one. On top of that, we're asking people to try and manage traffic as much as possible. So if you have a big enough room and you have multiple doors, have an indoor and an outdoor, so you don't have cross traffic. Track attendance, like I said, for the courses, if possible, to assist with contact tracing. And we'll talk about contact tracing right now. It's critical, the biggest point I want to make on this, it's critical that all employees, students, contractors, everyone on campus report positive tests, symptoms of COVID-19, or exposure to someone who's had a positive test or is experiencing symptoms on the online COVID-19 reporting form. This is critical. This is one of the best ways to protect all of us. We are taking a very conservative approach to contact tracing. So the CDC and state guidelines talk about, well, if you have a positive test result. The problem is, as I'm sure you've all heard, the test results can take a long time to get back. In the meantime, that person is infectious, has symptoms, etc. So we're going to go ahead and isolate or quarantine anyone who is showing COVID-like symptoms, even without the positive test. If they end up testing negative, close contacts, you might be able to return early. But we have had at least one case, a student athlete who had symptoms. We went ahead and put them on quarantine, or isolation, and put their close contacts in quarantine. And it was 3 or 4 days later, they ended up testing positive. And so that was protective of the rest of that team. A little more about contact tracing. I use these terms already. So isolation versus quarantine versus self-monitoring. This makes people very nervous, and these terms can be confused. So if you're symptomatic or you test positive, you're required to stay home for at least 10 days. That's isolation. If you're not symptomatic, but you were exposed to someone who is or tested positive, you'll be required to stay home for at least 14 days. That's quarantine. The thing we get the most calls about probably though is if you had close contact with someone who's been told to quarantine. So you work somewhere on campus and now your coworker that you had exposure to is in quarantine. You're nervous that those individuals might be nervous that, oh my God, I might have been infected. Well, actually, you're the 3rd degree of separation. We don't even know that those people in quarantine, the 2nd degree of separation, are sick or are going to get sick. And so there's actually nothing you have to do at this point except for self-monitor. And if you do start to develop symptoms, then you fill out that form and we start the process anew with you. Before you're allowed to return to campus, whether you're in isolation or quarantine, you have to be released by risk management because we're doing the contact tracing. This chart, not that you're supposed to be able to read it, this is the process that we follow for contact tracing. So sometimes people think, oh, well, I got a note from my doctor saying I'm good to come back. Yeah, unfortunately, that will certainly factor into our decision, but that's not the be all end all. We do have to go through the process with risk management. So what happens if we have a positive case in an in-person course, right? We've got a lot of questions about this as well. If a student is just quarantined, remember, they haven't been tested positive, they haven't shown any symptoms, they've just had a close exposure, we're still going to keep them off campus. And faculty may be able to help that student still complete the coursework by providing asynchronous instruction. If a student does become ill, now again, that's showing symptoms or testing positive, faculty, of course, will try and accommodate their needs, but the in-person class can continue unless, on the third bullet here, the student becomes ill and exposes other members of the course, or the instructor is put under quarantine. So a student who's sick, or it doesn't appear to be sick, but they come to class, they're fine, and then they become sick or they test positive, we are going to look back from the contact tracing folks are going to look back the last few days before they became ill or tested positive and see what courses they were in. And again, that may require the course to transition to an online format unless, as I mentioned before, we've got some information about who the student actually sat near or worked with in a group. If the faculty member becomes ill, well, we'll likely need to find a substitute instructor or transition online. I know there's been a lot of questions about that. I know Dr. Kapinas and Academic Affairs are working hard on making sure that this is a possibility. All right, moving on to dining options. So most dining options will be open on campus, but with modified operations. There's going to be more limited seating indoors to allow for social distancing. Face coverings, of course, are required except when seated and eating. So if you get up to get another slice of pie, go to the restroom, you need to put your mask back on. Additional outdoor furniture is being installed across campus, not just for dining, but just for more social distancing spaces around campus. There will be no self-serve or buffet options. So normally we would come up and spoon your own out. That's not going to happen anymore. It'll all be served by Chartwells or other staff. And there'll be always grab and go options available. So if you don't want to hang out in that space, there'll be that many more options to pick up meals. And some of the dining facilities, that will be the only option. We've got a lot of questions about HVAC systems, and I joke that that's because of a certain restaurant in China. You may have heard the story about a restaurant where a whole bunch of people got sick because of the HVAC system. That situation was studied, and what it was, it's not an HVAC system like what we have. It was more like a window unit where the air blew directly out of it across the table and the breathing space of the person who was infectious onto the tables downwind, so to speak. Our HVAC systems don't recirculate air within a room. Air from the entire building, the entire floor, or at least a large area is combined with outdoor air prior to redistribution throughout the building or floor. Facilities Management Construction Central Plant has increased the amount of outside air introduced to the buildings as much as possible. When I say as much as possible, basically as much as we can without there being mold and humidity problems. But every time the air comes out of a room, it's mixed with a certain amount of outside air, and that percentage has been increased. It costs more, obviously, as far as the amount of electricity to heat or cool that air, but in this case, it makes sense because current evidence indicates that infection requires exposure to a certain number of viral particles. It's not just one virus and you get the disease. Thus, dilution of, if you have one person who's sick and they're in a room and diluting what they're potentially releasing as far as viral particles is an effective preventative measure. So another facilities one, water bottle and hand sanitizer stations. So early on, we turned drinking fountains off per recommendations from the CDC and state health departments as a precaution. But the bottle fillers are still available. And in fact, facilities has put a lot of effort into installing more bottle fillers, which I think there was a lot of demand for before COVID anyway. Additional fillers will be added as they're available. Unfortunately, a lot of other universities and organizations are doing this. And so there's a little bit of a backlog on the supply, but they're going to install them as they come into stock. Hand sanitizer stations, the numbers of those have been increased dramatically across campus. There should be one at almost every entrance to buildings. Let facilities know about any issues with hand sanitizer stations. There was actually a suggestion, I think it was from Academic Council, to put the phone number for facilities right on the hand sanitizer station. So if it's empty or if the battery's dead, their phone number, in case you're looking for it, is 3137. That's their extension. And they're in the process of putting stickers with that number on the hand sanitizer stations. I do want to mention one thing about the hand sanitizers. This was covered in the original training, but hand washing with soap and water for 20 seconds is the most effective, right? That's the gold standard. That's what you want to do regularly throughout the course of the day. So if the hand sanitizer station isn't working when you come in or it's all used up, just go right to the restroom and wash your hands. In fact, we recommend you do that even after using the hand sanitizer, once you get into your area of the building. Building access and traffic control. So as you're probably aware, we had tightened up access control on buildings quite a bit, right? You needed to have key card access to buildings or you didn't have access at all. Those are going to be relaxed further for the fall semester. It's going to be slightly tighter than it was in previous falls potentially, but most of the buildings that you need access to are going to just be open like they used to be, which is to say you won't need key card access. Some doors, as I mentioned, will be designated as in and out, and some stairwells will be designated up or down. Obviously, you don't worry about this in an emergency. Fire alarm goes off, you pick the closest door like you've always heard me say before. But just try and use that so again, we're not having the cross flow. Passing in the hallway isn't a huge deal for the few seconds it takes, but this makes it even better. Elevators, we've gotten questions on this. They'll be limited to allow for distancing as much as possible. Most elevators will be limited to 4 people, and some of the smaller ones, such as Old Main and GRB, places at smaller capacity, they'll be at 2 people at a time. So, I wanted to talk a little about COVID-19 testing. So at this point, surveillance testing, which is to say testing of those who are showing no symptoms, just as a broad population, is not going to be feasible for TWU. To be effective, what we see in the literature is that we would have to really test all faculty, staff, and students basically weekly, maybe even every 3 to 4 days. And logistically, this just isn't possible for TWU at this point. Some universities are doing this. They very often have a hospital. They have the resources to be able to do that. And it's just not possible for us at this point. But a lot of the things we've talked about here and other things we haven't, we're being more conservative than CDC recommends in a number of other areas. Things like the contact tracing, putting people under isolation and quarantine, having to have VP approval to have any kind of in-person meetings. We're doing a lot of things to try and reduce the risk to the TWU community. That said, it is critical, and I'll emphasize this again, it's critical that TWU community strictly follow preventative measures, the social distancing, the face covering, hand hygiene, all the things you've heard us talking about. And there is some personal responsibility here, right? We want to protect the community. Things like wearing your face covering. It's not about you, obviously. It's about protecting you and protecting those that have to work near you. You may be an asymptomatic carrier of this disease. Cleaning the microwave handle after you use it, things like that. We're going to need all of us to do more than we normally do to help each other as a community. And with that, we are at the question and answer period.
Great, thanks, Matt.
But I saw a lot of questions going through.
Yeah, we have a number of questions here. I think several of them are academic affairs questions, so I might start with Dr. Martin if you are available. One of the participants asked about microphones. And in fact, that was a number of questions were about microphones and microphone covers. Can you talk a little bit about those?
Yes. So we worked with ITS and they have ordered microphone covers for every room. These are disposable one-time use covers. At this point, we are planning that they will be under the podiums in each room. Yesterday, we learned that they also have ordered some additional microphones. And for persons who are teaching in some of the largest rooms, we are going to try to distribute those microphones because they really help to have better sound coverage across the room. So at this point, we believe that every room that has a microphone and is large enough to need a microphone should have microphone covers available that are appropriate for the type of microphone in that room.
Thank you. Matt, I'm actually going to go to you for this one. It's been upvoted the most actually at this point.
Okay.
What about some of the tight points that we have on campus? There's some concern that if we have a lot of crossings, even if it's less than 10 minutes in tight points, that may cause some issues with spread. I think part of the answer is going to be we have such a smaller footprint and density of students on campus. So what you can imagine happened in the past is going to be very different from what's happening now. But do you have anything else you can offer to share there?
Well, I think that's a primary point. I mean, you think of, we were even in the cabinet, we were talking about how MCL gets so crowded, people waiting outside the elevator traditionally. But because of the drastically reduced number of in-person classes, there's a lot less likelihood of that. But also, obviously, it's, you know, it's possible you pass 5 or 6 people, I suppose, who are positive in that hallway. But, you know, again, each of those interactions is very brief, and CDC, again, we're even being conservative when we say 10 minutes. CDC says it's closer than 6 feet and 10 to 15 minutes. So, you know, the brief hallway crossings and things like that, again, we're certainly encouraging you to social distance as much as possible, but I'm not too concerned about passing in a crowded hallway if we're minimizing it as much as possible. Everyone's wearing their face coverings, and on top of everything else we're doing as far as in strongly encouraging that anyone who has any symptoms to stay home, whether you think they're COVID or not, right? Just stay home, fill out the form, and let's let the process keep that minimized on campus.
Yeah, thanks. I think also it's going to be a community response to helping remind each other when we see some log jams to encourage each other to space out as much as possible. This is definitely going to take all of us.
Agreed.
I have another question here about classroom capacity. So this is another academic affairs question, Dr. Martin. Are the classes capped at 50%, or some of them, there's some question as to some of those may not be, the system may not be capping them correctly. Are you aware of that?
No, I'm not. I was very surprised to see that. We did not place any class in a room where it had more than the cap for the class had to be 50% of the actual classroom capacity or less, and we've tried to make it much less. And when people make changes to the caps, we have been checking to make sure that that is possible within that particular classroom. And if it's not, we've been looking for another. So Dr. Stab, I saw that question was from you. If you will please send me an email about the courses you're talking about, that's very surprising, and we need to look into that if there is something that is not keeping the classes at the section cap.
Thank you. The next question I'll leave as for you also, and it's about office hours. So for those courses that are face-to-face, are we encouraging faculty to hold face-to-face office hours, or are we asking faculty to do other arrangements for that?
I think that I would encourage faculty to talk to their chairs about that, but we are across the campus encouraging that all meetings be we're trying our best to have those happen virtually. So the best solution would be to have a virtual meeting using Zoom. All of our faculty who are instructors of record will be receiving a Zoom account in the next few days. So that will be available to them. And also they can use Google Meet if they would like to do that.
Excellent, thank you. I have a question now about seating charts. So Matt, maybe you have some response to this. So some of the faculty have asked if we're encouraging faculty members to take seating charts in their face-to-face classes, how will the faculty be assisted in making this happen?
Yeah, and we'd been saying seating charts, and it's not that there has to be a you know, like a diagram showing where everyone's sitting, but if you have assigned seats, We've talked about different ways to do it, like maybe, hey, just have your students introduce themselves to the people on front, back, left, and right, and write that down on their syllabus or something. I mean, there's a bunch of different ways you can do it. What we really need, however, whatever solution works for the particular faculty, the particular course, that when we call a student who reports that they have symptoms or a positive test, if they can tell us who in the last couple days they were in course, right, or in class, if they can tell us who was around them, that will help protect your class from having to go online and go, or having everyone go into quarantine effectively. So I don't want to assume that we know the best way how to do that. Whatever makes sense. Maybe you just have everyone write their name on a card and take a picture the first day, and or these are your seats. I'm sure we can come up with some creative options for that.
Great, thank you.
Christopher, can I weigh in on that just a second? Because I saw a lot of questions about that, and I understand that's something of concern. We would recommend this time, especially for faculty that are teaching in an in-person class, that this is probably the semester you want to go next week sometime to the classroom while there's nobody there. And you might want to quickly jot down, you know, how many seats are in a row, how many seats across, and so forth, so that you can quickly have a seating chart. We are not going into classrooms and crossing out chairs, and I want to explain why that is. There's a very logical reason, and it's actually to make it more safe. We have different numbers of students in different classes that use the same classroom. If we went and crossed out chairs, we might be crossing out a chair that was needed for a smaller group to have a wider amount of space between students for the distancing. So we want, on the first day, we understand it's going to take some time to try to help students find their places. And we really want to, you know, help people with that. I see quickly, Juliet just put up a question about Hubbard, and I have answered this question today to several people. They're wondering how can they look at the Hubbard Hall classroom. Well, Hubbard Hall is a multi-use space, and it's going to be used, as I understand it, for some of the activities for students over the next week before we get to the classroom period. So Juliet, you're correct. They cannot look at that yet. We can check and see when that's going to be set up. There may be somebody on here who knows when that is, but for the fall, we are using Hubbard Hall ballrooms from Monday through Thursday during the day. I believe it's 8 to 4 or 8 to 5 that classes are scheduled there. And those will be set up as classrooms. New furnishings have been purchased for this. I met yesterday with IT, and all of the IT is in place or ready to be put into place once the classroom is set up. So yes, it may be a little bit later when those are available, but we will try to find out when that is.
Thank you.
I'll throw in there that I believe we actually have layouts that we designed. We have floor plan layouts for what the classroom furniture layout would be for the Hubbard ballroom. So if that's helpful, we can share those as well. Because obviously if the furniture isn't the layout that you will be using, you could at least look at those.
Yes. All right, I have a question now about syllabus statements. So whether we're going to have a syllabus statement with describing the difference between hybrid, synchronous, asynchronous courses. Do we have any help for that, Dr. Martin, in terms of how we can describe those in someone's syllabus?
Okay, so hopefully in the syllabus it would be clear, but what we are asking is that, and Dr. Cabinas has sent out information to faculty about this, we are asking every faculty member to go into their Canvas shell and put a welcome announcement on the Saturday before school starts, because on Friday we will finish registration, and on Saturday everyone should be in in place. Many of our classes are set up on alternating days. Half the class attends one day and the rest of the class attends another day. Students need to be informed which day they are going to attend. So putting out a welcome message, I think, to our students to explain exactly how the class will operate with synchronous, asynchronous, face-to-face, all of that needs to be explained in the welcome message. And I do know that Dr. Capinas plans to send out additional messages, and these are going to faculty, adjuncts, and GTAs, all of whom are instructors of record in these courses.
Thank you for answering that. Sorry, I'm just trying to sift through a whole bunch of questions that are still coming through here. Question about tutoring centers. This, I don't know, I guess, Jennifer, yeah, we have you here again still. So the question will be about, will instructors, well, actually, where did that one go? Maybe it has disappeared, but there was a question about whether the tutoring centers would, what kind of support students would have from tutoring centers.
All of our tutoring centers have been operating online, and I would expect that they would continue that. I did see another question there about tutoring centers, and I'm probably not the expert to answer this one, but there was a question somewhere about whether having meetings in the tutoring center with students to provide tutoring required permission from the vice presidents. And so I mean, if we are operating those face-to-face, Matt, you might want to take that question because I think that's in your arena.
Yeah, I mean, we're discouraging face-to-face as much as possible. We've had conversations about how to rearrange things so you have more spacing, but face coverings the whole time. And there, again, I'm not sure exactly the situation where the physical layout of what we're talking about, but there are plexiglass shields that have been put in the high, I'm trying to say high contact, frequent contact areas. So that's another alternative. But if we can do it on Zoom or Google Meet or whatever, that's probably the best option.
Dr. Brown, there was a question about, they're jumping around on me, so I lost what that question was, but it was basically about grab and go options on the Houston campus for food. Will there be any food options to your knowledge on the Houston campus?
There will not. I did respond to that just now.
Okay, perfect. That's why it went away. All right. This is maybe a question for Matt. When someone is quarantined and the building room has been shut down for quarantine, who will provide the feedback on when the building room is going to be put back online? Will the quarantine and potential sanitizing of the space, or will there be notifications about closure after reopening? Closures and reopening.
Regardless, I wasn't sure I got the whole question, but let me just put it this way. We will generally shut, if we're able to shut down a space. Now again, quarantine, let's be clear. And again, the terms don't really matter. The person who's sick, who is in their office, let's say, that's where they spent the majority of their time, we're going to close their office and just let it sit for up to 7 days. If it's a common area that the individual spent a lot of time, then we may hire a contractor to do the additional level of hands cleaning. So if facilities custodial are doing enhanced cleaning above normal, this is the folks in the Tyvek suits who clean if we need to get a space turned around immediately after being exposed to a sick individual. Quarantine folks, again, the quarantine folks, that's that second degree of separation. They're not showing any symptoms. They have not had a positive test. So we're not necessarily doing anything with their offices. We're just sending them home to see if anything develops.
Thank you. This question is really for a communications person, and I don't think we have any of the marketing and comm people here specifically, but I believe some of them are on the attendees list. But the question is about the coronavirus website and whether some of that data, some of it is out of date and needs to be updated. I think we've been updating that site pretty regularly, but that doesn't mean that there's some specific things that we could audit on that. So maybe Dr. Stab, if you wanted to send some specifics to Cindy Pollard, our Chief Marketing Communications Officer, she might be able to go in and make sure that what you're specifically referencing was addressed.
That's great. Yeah, anything you see like that, please let us know so that everyone has the most up to date. It's hard to keep up with that.
Will students or can students be told about seating distance and or door use expectations ahead of class? Oh, I see Dr. Kapinas has already answered this one, so I will let that one go. There was a question about vaccinations and will we be required to have a vaccination once a vaccine is available? And my response to that is that we just don't know enough about the vaccines at this time, to their efficacy, et cetera.
We'll be following the recommendations from CDC, state, local, and coordinating board.
How are we managing computer lab sanitation?
So, this is that we've had a lot of conversation about keyboards and whatnot. So as with the classrooms and other common spaces, facilities has distributed a large number of spray bottles containing a EPA registered disinfectant. It's very effective, but you don't have to wear gloves or anything like that, so it won't hurt you. It just hurts the virus primarily. And paper towels. So what we're asking, because obviously you can't have a custodian come and clean up before and after everyone uses a keyboard, is that before you use one, and ideally if you could wipe it down after you use it, just spray a little bit on a paper towel and wipe the keyboard and the mouse off, and that's really all we need to do. Custodial will be doing enhanced cleaning, obviously a couple times a day, but we can't do it after every user. So again, it goes back to the responsibility, personal responsibility of the community. Do your part.
One of the most upvoted questions I see here is about enforcement. So I know this has various levels, from HR perspective for employees as well as from students. Maybe we'll start from the student perspective. Dr. Brown, do you have anything that you want to talk about in terms of expectations on enforcement?
We really are planning to take a very educational approach and encourage students to take personal responsibility. All will be asked to agree to the Pioneer Pact, which is pioneers protecting pioneers, and part of that is wearing a face mask in all buildings at TWU. And that message will be reinforced across our various units in student life. If a student is egregiously not following that practice, we will engage the student conduct system and campus police, but fully expect that will be very rare. Most students will be responsive.
And from an HR perspective, do you have anything you'd like to add here, Amy?
Yes, we're handling as a, hold on, let me get this volume going here. Get a little feedback. So we are basically going to handle it through, peer enforcing, and then through the supervisory chain of command, and just as those issues come up, report it depending on the severity, but we're just asking people to work with each other to try to enforce the existing rules that are presented out there.
Yeah, so we have another question about a large lecture section that has over 100 students in it, and seating charts seem impractical in those situations. Do you want to talk a little bit about that, Matt?
Nope.
Or Drew?
I was just, reason I raised my hand, I was actually typing a response to that, and I should have let you know in the chat. So the reason why it's difficult, so let's say that's respective classroom, you have 106 students, the classroom after that maybe has 82 students, and the one after that has 95. Those seating charts will look slightly different because we want to space out as much as possible given a respective class. So if we made one for 106 and the person was 70 and they followed it, they would unnecessarily be seating their students too close together. So our hope was that that on the first day of class, kind of for your given session, you have your students spread out as much as possible, and then they kind of know where they sat, and they keep sitting there the entire time. And like Matt said, like, okay, learn your neighbors, jot that down on a piece of paper somewhere, and keep hold of that, so that we know this specific person got sick. We find out that information of who's in their bubble, let's say. So I get that it's a lot of work, but we're hoping that on the first day you can kind of do that once and then everybody knows that. What I can try and do though for the large classrooms where it is a little more burdensome is send, not necessarily everything spaced out because I don't know how many individuals are in a respective class, but at least send the drawing that shows the seats, and you would know how many are in your class and you can X out how many in between, and maybe that would help. So I'll try and get that together and we can share it. I can share it with Dr. Martin maybe to distribute.
Great, thank you. So students will be asking a lot of questions to faculty and staff who may not be equipped to answer those questions. Who can we direct those questions to? I'm hopeful that the more we all know, the more we'll all have a similar answer. And so sessions like this are hopefully going to help everybody have a consistent answer. I know in my office, we receive many questions daily from students and try to get them answered. I would say in general, much of student life is supporting answering student questions. So that might be one area to direct. Do you have anything else you'd like to offer?
I'd say that, you know, if it's a coronavirus or our preventative measures specifically, there's always risk@tw.edu as an email address, as another alternative, or they can call us. Yeah, I mean, we're more than happy to help out however we can.
So this question is somewhat broad also, but how proactive are instructors expected to be in enforcing social distancing, masks in the classroom? If the student complains about enforcement, are instructors now liable in any way?
Dr. Martin, I didn't know if you were going to jump in.
I'm just going to, I'm certainly not an attorney, so that's not one I think that's good for me to answer. But I can talk just about the fact that Dr. Kapinas has distributed guidance on how to handle a situation if someone comes without a mask. We're going to consider that it's not that they're unwilling. We don't want to jump to the conclusion that they're unwilling. I think in a lot of cases, it's just not yet part of our routine. So what we are doing is providing disposable masks to faculty. We're still determining, we'll have this within the next day or two, exactly how we're going to get those distributed. But they will be available so that if someone comes without a mask, you can offer them a mask and ask them to please put it on. Only if that person refused would the faculty then move to the next step, which could be, if the faculty member chose to dismiss the class. And we would recommend that if the student is refusing to follow this guidance, then eventually the next step would be going through the conduct process, which we use for any kind of a behavioral issue. We've had a lot of questions about calling public safety, and we are discouraging that. We think that the best thing for you to do is to dismiss the class and to file this as a code of conduct issue and let it move through that process. However, we don't want anyone to be subject to aggressive behavior, and if you feel in any way threatened or that there is aggressive behavior, of course they would call public safety.
I'll throw one correction out, well, not correction, additional information from the previous question. I was just reminded that we still have a coronavirus@tw.edu email address, which was kind of served as our clearinghouse for all questions. So that's an option as well.
Thank you. So I have a couple of questions here also about instruction. One is, if you are in a classroom where you're more than 10 feet away from the front of the room, are you still, as an instructor, required to wear face covering?
Yes, it's required anywhere inside TWU buildings unless you're in a private office, which is why Christopher is not wearing his right now.
Thank you. There was another one similar to that about students who rely on reading the instructor's lips. How will they be able to continue to do this? What kind of accommodations will we make? So there's Crystal, I think, is on this call. Is Crystal still here?
I'm here.
Well,
Can you repeat, please? I'm sorry, one more time.
The question was about students who are depend on reading faculty members' lips for getting instruction. What kind of accommodations are we making for those types of students?
We do have a limited supply of masks with a clear panel in disability services. So if faculty will reach out to us at dss@twu.edu and let us know that you need one, we can lend them out. But please be aware that these masks, after a little bit of conversations, they can fog up. So you'll have to be prepared to use a little cleanser to clean it off. But yeah, we do have masks available that have that panel, so it's not cloth in the front.
Thank you, Crystal.
And just from my knowledge, Crystal, presumably if you had someone who is needing that accommodation anyway, they've probably worked with you to look at all their alternatives as well. So that might not just be the only option.
Absolutely. And a lot of this, we are, building this plane as we fly it. And you know what I mean? And so students will come to us with maybe accommodation issues that we hadn't considered concerning the barriers that COVID-19 may present to them. And so it's a work in progress.
There's many answers to that question. So it's interesting to read through, including using toothpaste to clear the plastic from fogging up. And this question has been asked already and answered on the Q&A section of this webinar, but I'll just go ahead and ask it again live because it seems to be coming up again. And that is, what sort of PPE are we providing, and is there various cases where the university is providing some PPE, or everyone's expected to bring their own?
For the most part, everyone's expected to bring their own face covering or other PPE to campus. There was a few exceptions that we've made for folks like, let's say, the movers within facilities, where they are necessarily exposed to each other the whole time. So we got ones that were more suitable for their work, as kind of like their uniforms and things like that. But by default, the answer is that we should just provide your own face coverings or other PPE.
Thank you. More questions about microphones, but I think they might have been answered really. The question is really about, are there going to be some protocols or procedures for how to sanitize stay in place microphones? And I believe the answer to that is that the Center for Faculty Excellence, in collaboration with Environmental Safety and Health, is working on some protocols that might be helpful. Is that correct?
Those are going to be covered with microphone covers, and the person can just place the microphone cover off and then on, and then pull it off when they leave. It is completely disposable. In some cases, with the new microphones that we learned yesterday that ITS has received, that we will be distributing, as I said, a few microphones to persons teaching in some of the largest spaces. And so we will be contacting those faculty. But we are covering the microphones instead of sanitizing them.
Thank you, Dr. Martin. Well, we just have reached the end of our hour. I know we haven't answered every question that's on this forum yet, but we will be getting, since every question is attributed, we'll be able to get back with you about the questions and try to finish answering them so we don't take up any more of this hour. But I really appreciate everybody coming and participating. The more I think we know, the more that we can help dispel myths, help other members of our community understand what to expect. And when we have those expectations a little bit more firmly planted in our heads, it helps us also build courage, I think, and to move forward with the mission of this institution. And so I really appreciate everybody coming to this webinar, and we will continue to communicate as best we can through email, social media, and more of these types of experiences. Thank you again.
Thanks, everyone.